So I just want to revisit the tyrosine degradation pathway because, as Dr. Gahl mentioned, so the deficiency of the third enzyme, which is the homogentisate dioxygenase, that's what leads to alkaptonuria. But we've learned that nitisinone actually inhibits the second enzyme in the tyrosine degradation pathway, which is the 4-hydroxyphenylpyruvate dioxygenase enzyme. And when you inhibit this enzyme, it actually prevents homogentisic acid from being formed. So that's the sort of the mechanism of how this is beneficial for patients with alkaptonuria. I also want to draw your attention to an important fact that we're going to talk about more later, but at the first step that converts tyrosine to the 4-hydroxyphenylpyruvic acid, that is a reversible step. So when we inhibit the second enzyme, the 4-HPPD, that allows tyrosine to accumulate. So that is an expected finding in patients who were receiving nitisinone treatment. And we'll talk more about that in just a minute. So the most immediate effect of reducing the homogentisic acid is that the urine no longer turns colors. And we've demonstrated this actually in multiple different studies that a low dose of nitisinone, that is 2 milligrams a day, can actually reduce homogentisic acid excretion and production by about 95%. So this graph on the left is showing in red patients that were receiving nitisinone and the dramatic reduction in homogentisic acid excretion compared to the line in blue, which is patients that were in a control group that were not receiving nitisinone, and they continued to excrete somewhere between 5 and 7 grams of homogentisic acid daily. And the figure on the right is just demonstrating how patients, when they're on nitisinone, their urine no longer changes color, so it becomes a much more typical color. This will be the first thing that patients will notice when they're on the medication, and I guess this is the most obvious sign. So we designed a clinical study that was an open label study. It was not a placebo-controlled study because, again, patients would recognize immediately whether they were receiving the medication or not. So we did not blind patients because they would be able to tell right away. We enrolled 40 patients, and it's important to note that the patients that were enrolled on average were 51 years old. So these were individuals at the time of enrollment who already had substantial spine and joint involvement at the start of the study. Patients were randomized then to either receive 2 daily or to receive no medication at all during the study. And the findings that I want to discuss in particular today relate to patient-reported outcomes, that is the SF-36 questionnaire, and the 6-minute walk. SF-36 questionnaire is a well-validated patient survey that assesses quality of life that patients report. They answer the questions and report how they're feeling. It assesses quality of life across 8 different domains. And some of those domains include pain, physical function, energy and fatigue, overall health, as well as some other domains like role limitations due to emotional problems or emotional well-being. The 6-minute walk test is a functional outcome, literally measuring the distance that patients can walk in a 6-minute time period, and that duration is, or that distance is measured in feet. So I want to focus on a couple of the domains in particular from the SF-36. It's important to note that patients who were receiving nitisinone actually improved. They showed improvements across all 8 domains of the SF-36 questionnaire. But the domains that were most significant, 2 of those are energy and fatigue and pain. And when you look at these graphs, there's 2 separate graphs here, one for energy and fatigue, one for pain. And on the left-hand side of both of those graphs are patients that were not treated with nitisinone. The coral-colored bar represents their score at the start of the study, and the teal bar represents their score at the 3-year time point. And that's the same for both of those graphs. The right-hand set of bars represents individuals that were treated with nitisinone, and the dark line in the middle indicates the median for those individuals. And we saw statistically significant improvements in both energy and fatigue and in pain for patients that were receiving nitisinone over the course of the 3-year trial. Similarly, when we looked at physical functioning, this was actually one of the more dramatic areas where we saw improvements that our patients reported. And in this graph, the yellow bar represents patients that were untreated, and the blue bar represents patients that were on nitisinone. And these, the y-axis represents the change in score. And when we compare the nitisinone-treated group to the untreated group, we saw statistically significant gains between groups in the area of physical functioning. Likewise, the 6-minute walk test, which is another measure of physical function. We saw improvements in patients receiving nitisinone from the initial time point to the 3-year time point. So we were pleased because we have multiple indicators across both what patients were reporting to us and what we could measure, showing statistically significant gains in physical function. Just looking at this another way, these are some of the numbers, so you can see them quantified rather than in the bar graph of the changes that we're seeing. Again, these numbers represent the average change in the domain scores, and the p-values are from paired analyses between both the nitisinone group and in the untreated control group. And we saw statistically significant gains in both pain, energy and fatigue, and physical functioning. And those gains were not realized by patients that were in the control group. And finally, with the 6-minute walk, again, over the 3-year period, the patients that were receiving nitisinone had gains in the distance that they were able to walk on average over the 3-year trial. I remind you that the patients that were receiving or that were participating in this study were already individuals that had advanced involvement with alkaptonuria. So we were pleased to see that individuals, even with more advanced disease, can benefit from the use of this medication. I actually want to pause here for a moment, though, and just make a couple of points of clarification. We talk about pain being reduced and that the patients reported decreased pain as participating. But I want to remind you that this is not a pain medication. So this is not something where patients have an immediate pain relief from taking the medication. These are slow gains that are realized with time for these individuals. The individuals that stand to benefit the most from taking nitisinone are actually young adults who don't already have a lot of spine and joint involvement. We expect this to be more of a preventative medication for them, to be protective for them in the long run. And I fully expect from those individuals that they're not going to notice a lot of difference because they don't already have a lot of involvement. And that's what I would expect. Because they're not, they could be on the drug for 5 or 10 years and not feel much different. But we know from our natural history study that patients that are untreated actually experience significant degeneration in that same time period. I also want to say that taking this medication is not a free pass for individuals to do any activity they want. We're very careful with individuals with alkaptonuria to recommend activity that's sort of low impact and avoiding heavy lifting. And we really think that continuing that sort of musculoskeletal awareness and protection is going to really augment the benefit that we see from the medication. So we encourage patients to combine those therapies. That's important. And then the last thing I want to say is that when we're thinking about prescribing this medication for our patients with alkaptonuria, we really strongly encourage patients to be referred to a biochemical geneticist. This medication can be prescribed by primary care managers, and much of it can be managed by primary care managers or specialists. But biochemical geneticists are going to be very familiar with alkaptonuria and also well-versed in the use of nitisinone. And so if things like dietary changes are necessary, biochemical geneticists, along with their nutrition colleagues, are going to be well-positioned to help patients with managing this medication.
Important safety information. Indications. Harlequin is indicated for the reduction of urine homogentisic acid, HGA, in adult patients with alkaptonuria, AKU. Important safety information. Do not prescribe Harlequin to patients allergic to nitisinone or any other contained ingredients. Warnings and precautions. Ocular symptoms and hyperkeratotic plaques due to elevated plasma tyrosine level. Ocular signs and symptoms including keratitis, corneal opacities, corneal irritation, corneal ulcers, conjunctivitis, eye pain, and photophobia have been reported in patients. Perform slit lamp examination prior to treatment and regularly thereafter. Re-examine patients if symptoms develop or tyrosine levels are greater than 500 micromoles per liter. Assess plasma tyrosine levels in patients with an abrupt change in neurological status. Perform a clinical laboratory assessment, including plasma tyrosine levels, in patients with an abrupt change in neurological status. Leukopenia and severe thrombocytopenia. In clinical trials, patients with hereditary tyrosinemia type 1, HT1, treated with another oral formulation of nitisinone and dietary restriction, developed reversible leukopenia, thrombocytopenia, or both. No patients developed infections or bleeding as a result of the episodes of leukopenia and thrombocytopenia. Monitor platelet and white blood cell counts during Harlequin therapy. Adverse reactions. The most common adverse reactions, greater than or equal to 1%, reported in patients with AKU taking nitisinone in clinical trials are elevated tyrosine levels, thrombocytopenia, and keratitis. Drug interactions. Nitisinone is a moderate CYP2C9 inhibitor and a weak CYP2E1 inducer. Potential clinical impact of Harlequin administration with CYP2C9 substrates. Reduce the dosage of the co-administered drugs metabolized by CYP2C9 by half. Additional dosage adjustments may be needed. Nitisinone is an inhibitor of OAT1/OAT3. Potential clinical impact of administration with OAT1/OAT3 substrates. Patients should be monitored for potential adverse reactions. Use in specific populations. Pregnancy. Limited available data with nitisinone use in pregnant women are not sufficient to determine a drug-associated risk of adverse developmental outcomes. The background risk of major birth defects and miscarriage for the indicated population is unknown. All pregnancies have a background risk of birth defect, loss, or other adverse outcomes. Lactation. The developmental and health benefits of breastfeeding should be considered against the mother's clinical need for Harlequin, along with potential adverse effects on the breastfed infant from Harlequin or from the underlying maternal condition. Pediatric use. The safety and effectiveness of Harlequin have not been established in pediatric patients with AKU. Geriatric use. Insufficient data from clinical studies of Harlequin to determine if patients greater than or equal to 65 years of age respond differently. Elderly patients should be cautious reflecting any decreased hepatic, renal, or cardiac function, and of concomitant disease or other drug therapy. For more detailed information, please refer to the full prescribing information at harlequin.com/PI. To report suspected adverse reactions, contact Cycle Pharmaceuticals at 1-855-831-5413 or the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.